Welcome to Elevated Practice, where we interview masters and mavericks within the field of holistic medicine and uncover unconventional stories in the field of health and wellness. I'm your host, Gretchen Badami, and every episode I'll be interviewing clinicians, scholars, entrepreneurs, and educators who share their wisdom and ideas with you. Are you ready to elevate your practice? Let's begin today's episode. I'd like to extend a big thank you to Handcraft Health for sponsoring Elevated Practice and empowering integrative healthcare practitioners to create personalized healthcare packages for their patients. Create a free account today and elevate your practice at www.handcraft.health. And now, on to today's episode. Today, we are here to talk about integrative oncology. I'm here with the esteemed Dr. Hua Bing Wen. Dr. Wen graduated medical school from the Beijing University of Chinese Medicine, and he did his residency in integrative medicine. He has worked as a physician in the internal medicine department and had a unique experience working for 3 years as a physician in charge of the ER. He has conducted research using herbs and acupuncture to treat diagnoses such as diabetes, stroke, heart disease, kidney disease, thyroid conditions, as well as our topic today, treating individuals with cancer and using integrative modalities as an adjunct to chemotherapy and radiation. Since 1995, he has been teaching continuing education classes. Since 2002, he has taught in Chinese medical schools throughout LA, teaching classes such as internal medicine, clinical medicine, and doing clinical supervision, as well as herbal medicine. I got to know him in Los Angeles. He has had a practice in Beverly Hills for over 3 decades. Dr. Wen, hello, and thank you for being here today.
Thank you for the nice introduction, and it's my pleasure here.
Thank you. I hope I got it all correct. And, this was just the tip of the iceberg. You have had such an esteemed career doing so many things and helping so many people. So this introduction was just a small bit.
Thank you.
Thank you.
Mm-hmm.
As we get started here, I want to speak just a little bit more about your background. I'd like to know what started your interest in working in integrative medicine, the medical system that you went through and the hospital that you originally worked at did practice integrative medicine. Where did your interest begin?
When I look back, I think medicine is probably the only one choice. I always wanted to do both conventional medicine and traditional Chinese medicine. So back then, Beijing University of Chinese Medicine, has the best program. We 6-year program, have conventional medicine, have traditional Chinese medicine. So that's how I get started. So practice, after a graduate, we also have a choice. You want to do just traditional Chinese medicine. You want to do the integrative medicine. Some of my classmates actually just practice conventional medicine, after graduation. So that's give you an idea how those program was like. For myself, the more I practice, I find out, the integrative way to treat the patient is probably way better than the individual, system. So that's the longer you practice, the more you appreciate, the strength from both systems if you can use it. This is the best interest and for the patient, and also you can benefit the most from what we have today.
And you were able to then go through your education and learn a full medical degree within both the conventional medical system and then practicing the integrative medicine with your patients. You told me some fascinating stories about your work in the ER, which was a very unique experience that a lot of people don't have an opportunity to do. Can you share a little bit about your time in the ER using integrative medicine?
For sure, it's a very unique experience that many practitioners they have. So when in the ER, life-threatening most times. You have heart attack. Everything's very urgent. So the situation back then, first thing first, needles RIN-17 right in to stimulate before you hook up the EKG machine, with all the blood drawn. That is the type of very unique practice, you don't see it in the West. And so people, come in and say, oh, so pretty much a stroke case, the IV lies already in, and you have the herbal extract already put in before the CT scan, before. It's a very unique type of a practice. That type of training basically require you have to think fast, respond fast, quick, because the patient's life is down the line. So that makes me, in the long run, a much better doctor, because everything you think is not from one perspective. You always have to look at it from different perspectives. You have a much, much better sense of evaluation of the patient. This is urgent. Yeah, this is okay. This is no. We need to refer the patient to the ER, to have further, examination. That's a very, very unique experience.
Yes, what an amazing opportunity to have been able to do that. And you're right, probably will not be anytime soon that we'll be employing some of these methods in the ERs in America, but it's incredibly hopeful to at least hear it is being done in other places successfully. With your history and your background doing integrative medicine, how did your interest in integrative oncology develop as a subspecialty within your general overall practice?
When it comes to cancer care, we pretty much know this is a global, issue. We see more and more, cancer patient every year. So regardless, like how many breakthroughs we have in terms of treatment, is one thing I strongly believe is that multiple factor involved. Genetic mutation is just one factor. There's other factors definitely involved. And so that means all the treatment probably not like cookie cutter type of treatment. It's very standardized. You cannot cover. There's always a certain angle, certain perspective. You cannot cover it. For example, right now, we always joke about, the traditional approach, right? Surgery, chemotherapy, radiation therapy. So right now, there's the immune therapy. There's other therapies more popular. Speaking of the immune therapy, in TSM, what is cancer? Right? You have the rich Qi deficiency versus the evil Qi, excess evil Qi accumulation. So yes, that to address the immune system, the most current advanced CAR T therapy, those are actually very similar to the idea in Chinese medicine, focus on the rich Qi, meaning focusing on your immune system. And I'll give you an example. Qi tonics we have, ginseng astragalus, the study is showing those are the very good ones to stimulate the T lymph cell, which is a very important part of the immune system. Those two, can help to increase or improve. There's one particular type of cells called the natural killer cell, which is responsible for killing cancer cells and the viruses. It's this whole idea, from Chinese medicine perspective, to focus on your rich Qi, to strengthen that, to be able to take care of the evil Qi, including cancer cells. And with all the studies and research available now, the integrative medicine is the combination. Yeah, you combine both systems, so you can, help each other. Yeah, so this is why, the integrative medicine is oncology. Yeah, it's very, very useful.
And isn't it fascinating to see that in conventional medicine, previously, the main tools, which were surgery and radiation and chemotherapy, would correlate with the Chinese medicine idea of expelling some sort of a pathogenic factor, to take it out of the body, to either cut out the phlegm, to dry up the dampness, but then they would damage the body's righteous qi. And Chinese medicine has a way of looking at strengthening the body, which now conventional medicine has come around to the idea of immunotherapy. So it's fascinating to see our way of diagnosing the body reflected now in some of the understandings that are being employed through conventional medicine.
Yeah, that's very, very true. So remember, we talked about in conventional medicine, the focus is still disease, even though you have to have a diagnosis, right? And then we have to figure out what is the causes, what is the pathology before you establish any treatment. So the focus is always disease-oriented. You need to have diagnosis, right? Yeah, if it's no diagnosis, we can't treat it. The doctor always says, we don't know, maybe just manage the symptoms, but we cannot treat it. But in Chinese medicine, the focus is always the people, the person. Okay, so all the basic stuff, always your energy level. We always use a very simple way. The jing, the essence, qi, the energy, and the shen, the spirit. Okay, so you want to see is you have enough energy, your basic function are okay, the body structure-wise is okay, the spirit, the emotion, they're okay. So the idea is in Chinese medicine, how to keep the harmony, balance. So make sure physically, emotionally, psychologically, mentally, they're all. What is the purpose of medicine? You want quality of life. No one argues with that, right? Statement, quality of life. So Chinese medicine is the focus to improve the quality. If we cannot eliminate cancer, you can have a good quality of life. Even you have cancer, it's still a good treatment. And so fortunately, that whole idea to live with cancer in conventional medicine, oncology, this is a new idea. We cannot eradicate the cancer altogether. So sometimes it's impossible. But if we can live with the cancer, manage it, you have a good quality of life, that's still good treatment. I'm so glad that is, the common ground now is very, very similar.
And when you have a patient come in who has received a cancer diagnosis, what is your thought process as you are interviewing and analyzing that patient and doing your assessment? When you go to treat the patient, how do you determine whether you should first focus on eliminating the pathogenic factors, such as the reasons why the cancer is being created within the body, versus thinking about strengthening the patient? How do you decide what to prioritize in those cases?
Patient come in, we already got diagnosis, breast cancer, stage 3, stage 4, you already have that. Normally, we have to follow the rules. They already have a plan. Probably they'll do 5-6 rounds of chemotherapy to shrink the cancer, and then they'll do surgery. Right now, it's very, very common combination. Based on their plan, what can we do, to help? Oh, they're about to have chemotherapy, like in 2-3 weeks. So is there anything we can do to prepare the body to be ready to have chemotherapy? What's the possible common side effects they may experience? So you actually can go one step ahead. This typical chemo combo may cause a lot of diarrhea, digestive issues, GI issues, or that could be a lot of issues with the nerve damage, peripheral neuropathy, chemotherapy-induced neuropathy. You pretty much have that idea, so you can in the gut, before they get hit. So that is a very advanced thinking. You can do something to prevent something from happening, not wait until the GI is already being damaged, they already have nausea, vomiting. Oh, let's treat it. That is a very, very important way of thinking. So you to plan your treatment. The most of the practitioners are worried. It's like, oh, it's cancer patient. It's so scary. I don't know. It's the fear. I don't know what to do. Maybe if I do something, it'll be wrong. Well, stick to the traditional approach. There, the jing, the qi, the shen, the spirit. Focus on that. You'll be much better off. At a certain point, we have to communicate with oncologists. And most of the oncologists I work with, actually, they're very open to acupuncture and herbs. Depends, because they're worried about herbs interference with chemotherapy. When it comes to Chinese herbs, roughly classify 2 groups when it comes to cancer care. One is anti-cancer herbs. There are about 20-30 commonly used anti-cancer herbs, which have anti-cancer properties very similar to chemo. Sometimes we have a need, I call that like full chemo treatment. But the other group, they don't have those anti-cancer properties. So they are the ones that actually we focus more on how to strengthen the GI function, like I mentioned earlier, how to strengthen the immune system, because like that's a known fact. When you have chemotherapy, radiation therapy, and you kill cancer cells as well as normal cells. So that means if you kill a lot of normal cells, you weaken the body's immune system. This is so how to boost the body's immune system, keep the immune system stronger by using tonics, a special group in Chinese medicine. That's how we, how we do it.
You've mentioned that there are certain herbs that you would use to strengthen the body and certain herbs that are anti-cancer herbs. When thinking about treating a patient after they have finished conventional therapy, let's say after chemo, after radiation, if the patient is willing to stay on herbs when their conventional treatment is over, would you continue to give them not just herbs to boost their body, but also anti-cancer herbs to perhaps prevent the cancer from coming back? Or would you just choose to give them strengthening herbs to continue to help their immune system? How would you choose that balance?
The anti-cancer herbs also has the place for patient. They already done 3 rounds, 4 rounds of chemotherapy, but their tumor marker is still high, but they're already done all the possible treatment. So patient may also say, I want something different. If they have gone through this for a few years, they know all the modalities, how that works. Rarely, you just use the anti-cancer herbs by itself. It's always be combined with immune boosting herbs and other herbs to protect the GI tract and to protect the liver kidney function. So make sure it won't be too harsh on the liver and the kidney. So you may see the combination of a few group of those herbs. But the anti-cancer herbs is always a small part in the whole treatment. The thinking behind it is like you can't just kill all the cancer cells, but you have to make sure the other organ, the other system will be protected and they still can function. That's the idea.
And when you're communicating with the patients, Western doctors, if you are doing the communication with them or if the patient is doing the communication with them, have you found a particular way that the doctors become more receptive to herbal treatments? For example, explaining the herb functions. Do you take the time to do that? Have you found that to be useful, or to give them the Latin names of the herbs? Have you found a way to maximize the possibility that they will allow herbal treatment?
You have to work, with both. First of the patient come to see you. Normally we'll explain in details what those modalities do. Let's see, acupuncture. Okay, because we're talking about every single treatment of chemo, radiation. For example, patient come in, every 3 months they have to have an imaging test, MRI, CT scan, and some patients develop a condition called scan anxiety. The anxiety induced by scanning, which is a real thing. This is actually a legitimate diagnosis now. So 3 days, 5 days a week prior to the date, they're supposed to have this scan. They get so nervous, so anxious that it cannot sleep. They get restless. So what do we do? Acupuncture treatment to basically help increase endorphin, dopamine, calm them down. There's also a herbal formula we use to help regulate the vagus nerve, to balance the sympathetic and the parasympathetic nerve to keep them calmer. So you have a very specific approach just for that. You don't need to take the formula for any other time. Only take it right before, a week prior to the MRI, the CT scan. The patient needs to be informed. Don't tell them, okay, you just leave it to me. I'll take care of everything. No. They need to know what they're taking. So like the predicted effect, from the tonics or from taking the herbs that will protect the GI tract. The patient also wants you to communicate sometimes with the oncologist. So that's what I'll talk to the oncologist. There's no anti-cancer herbs. We'll focus on the GI tract. We'll focus on the energy, because fatigue is also another common side effects from all the chemo treatment, and also the emotional perspective. That's pretty much the focus. Those treatments, those herbs, the formulas won't be interfering with chemo treatment and radiation treatment.
Yes, and it sounds like the patient as well as the doctor should be aware that you will be in constant communication, and the formulas will continually be changing week by week, depending on the patient's emotional state and where they are within their treatment. The patient should expect to come in weekly to have their formula changed.
That's true, because the coming weekly, two reasons. One is the acupuncture. If you sit out too long, you don't get enough stimulation to release endorphin and dopamine. Unfortunately, that's the fact. And the second, as a practitioner, you need to know their response to the treatment. Based on the response, is my diagnosis correct? Or is there something off to prove or disapprove your assessment? Do we need to stick on the same, or do we need to change it and modify a little bit? That is the reason.
Let's pause for a moment to extend a big thank you to our sponsor, Handcraft Health. I prescribe a lot of herbal medicine in my practice, and quite frankly, I don't want to spend the overhead keeping hundreds of herbs and supplements on hand. Since the pandemic, I do a lot of telehealth consults and ship patients their prescriptions. Handcraft Health has been my lifesaver. It allows me to have a successful and streamlined practice and saves me money and office space. I am not tech savvy, but the platform is really straightforward for me to write and easy for my patients to pay online and receive their orders at home. It's free for practitioners to open a Handcraft Health account. It's just handcraft.health and only takes a few minutes to sign up. It's one of the easiest choices you'll make to do what you do best. And now, back to our episode. Regarding radiation, if a patient is going in for radiation a couple times a week, do you have them come in for acupuncture right before radiation or after radiation? Do you schedule the appointments in between the radiation sessions, or do you find that it doesn't matter?
Radiation doesn't matter much, because they pretty 5-10 minutes session each day. They do 5 days, right? Normally 5-6 weeks. Now there's some variations. You could do the back-to-back treatment, shorter period, or intense treatment. That's actually okay. But when it comes to chemotherapy, it's a little bit different. So we'll ask patients to come in before the chemo to basically prepare them up. After chemo, depends. Some people say like day 3 is the worst day, or day 4. Some is a little bit earlier, day 2. And it's very interesting to see the patient. They already have had a couple of rounds of chemo, so they know the drill. They know which day they cannot function. After the treatment, acupuncture, taking the herbs, they don't have that feeling anymore. They're not so bad. They can function. So they can compare to themselves, which is a very good study. Self-studies, like the first 2 rounds, without treatment, without acupuncture and herbs, how did they feel? And after the round 3, round 4, with the treatment, how they feel? The patient always feel like, hey, it's like that. If we knew this is the thing, we probably should come in the first round, because the patient always says if it's working, not working. The self study probably is the best way to tell. Yeah.
Yes. No need to try to convince them. They will understand on their own.
They will understand. Yeah.
You've had such a large sample size with all of your patients who you've treated through their oncology journeys. Have you been able to, over the years, look back and see either particular body types or particular emotional types of people who may be prone to developing cancers throughout holistic medicine? And in Chinese medicine, we talk about certain emotions being connected to certain organ systems and the idea of excess versus deficiency with cancer. But what have you seen clinically in terms of what sorts of people are prone for certain types of cancers?
Cancer. That's a very, very interesting question. I think, Gretchen, that's $1 million question. If we can predict who is going to get in oncology right now, there's genetic testing, but it faces a lot of challenges, and the participation rate is very, very low. They're trying to figure it out and how to encourage people to join the test. Any test, the bigger the sample size, the more accurate you may get. The challenge is not everyone likes the idea of you may have certain type of cancer in next 10 years. The percentage is about 35%. People don't know how to deal with it. If you tell me in 10 years, if you don't do this, it'll be 80%. They'll be eager to do something. But if you tell me it's 35%, what should I do? This is a very challenging question for a lot of people. For example, the breast cancer patient I mentioned earlier, they do the BRCA gene, 1, 2, sometimes, you do preventive treatment, surgery, to cut off any chances, to have breast cancer if you remove both. Not everyone are ready, for that type of radical treatment. But if there's a certain pattern that we can follow, that may be addressed early, preventive treatment to delay or to prevent from developing cancer. I think definitely there's things that we can do. For example, chronic inflammation become a very hot topic because chronic inflammation could lead to cancer development. For example, pancreatic cancer. How many times you hear diagnose the pancreatic cancer stage 1? Very few. Always stage 3, stage 4. It's already too late. Among all those risk factors, there's one risk factor called chronic pancreatitis. Patient may have a history chronic pancreatitis for probably 10, 15 years before they develop into pancreatic cancer. If you have a 10, 15 years to do something to prevent that from developing further, isn't that wonderful? In conventional medicine is, you have a chronic pancreatitis. If you're okay, most times that's pretty much it. You have acute flare-up, okay, we'll treat it, that's pretty much it. But from TSM perspective, we need to figure out liver and the spleen is not happy together. There's too much damp accumulation. There's too much cold. Colon is the pancreas, the GI tract don't have enough heat energy to move. You got too much toxin accumulation. So based on TSM model, you can always find a pattern that you can address. That type of treatment is a preventive treatment that could have a very positive outcome in the long run. So this is just one example. There's a lot of other conditions that have very similar situation. We joke about how you compare conventional medicine with Chinese medicine. Conventional medicine is very precise, evidence-based. Everything's about the measurement. You look a person from the front. We need to know exactly how big the distance between the two eyes, what's the shape of the face, the color. We need to know all that. Everything is measurable. The eyes are too close together. There's a problem, right? This is how you figure it out. Internal, imaging test and everything. Blood work is all measurable, precise. Chinese medicine is look for person from the back. You cannot see clearly, but you can see the head tend to be tilted to one side. The body seems, a little bit wobbly. The walking is a little bit wobbly. So you can see more from the functional perspective. There's something off with this person. Integrative medicine is even better. You combine the conventional medicine and the Chinese medicine. So you can have a much better assessment. Integrative medicine has been in China since the 1950s. There's a lot of research, a lot of study. And clinically speaking, this is probably the best thing.
When I'm teaching new students who are still in the beginning of the program, I always encourage the students by telling them how amazing practicing holistic medicine is, and that at some point they will actually be able to predict the future for their patients. They will have patients come in the office with disorders, let's say of the digestive system or chronic inflammatory disorders, and you as the practitioner are able to predict if they don't change their ways, if they continue on the path that they are on, there are a set number of differential diagnoses that can be followed. And this may be a patient which down the line ends up developing cancer of some particular area or ends up having a particular heart problem. And the students are always fascinated by this idea that we can understand the outcome 5 or 10 or 15 years down the line for a patient that we see in our office today. But it's true, isn't it?
It is very much true. This is actually the core concept in traditional Chinese medicine. It's like what you see the manifestation outside. There got to be something changing inside. In medicine in general, early diagnosis, early treatment is the goal treatment. But how early is early? How many times you hear patient come, they got this headache, and they got this stomach issue, they went through all the tests, nothing wrong. The doctor said, oh, you're okay. It's not the doctor's fault because that's the limitation of all the tests in conventional medicine. That's all we have. Before we develop anything new, we cannot tell you're okay or not okay. At least by all the tests we have, you're okay. But you're not okay. You're suffering. You have this problem for quite some time. So from Chinese medicine perspectives, like if you have symptoms, check the pulse, look at the tongue, something wrong. We have to address it. Yeah. And so if everything is being corrected, you don't have the symptoms, you feel okay. You prevented something from being more serious. See, this is also the prevention we're talking about.
What is the saying? The best doctor is the one whose patients never develop illness.
That's right? Prevention. Yeah. So prevention is the best medicine. I guess that is still very much true. But
in your practice, after they have completed treatment, do you have the opportunity or the time in your practice to overhaul the diet and nutrition? What do you do after the current round of treatment is over in order to prevent the cancer from coming back from all of the reasons that it was created in the first place? The food that they were eating or the lifestyle that they were engaging in. Are you able to have those conversations with the patients? And do you find them to be successful if you do?
You always have to do the talk. The talk is a little bit different. Like, okay, what's the treatment right now? What is the treatment plan? But what do we need to also do after the treatment? You have this particular type of cancer in the first place. Besides the genetic, mutation, there's also a lifestyle impact. Those conditions relate to chronic inflammation, which is pretty much the more common factor, if you ask me, causing cancer. All the lifestyle, smoking, drinking, alcohol, drugs, all that's a lifestyle issue. And it's just a matter of time because the system is not being corrected. They still follow the way how they develop cancer in the first place. So we have to do something to break that cycle, to change it. Yeah. So from TSM perspective is what? The sleeping pattern. You cannot stay up 2, 3 a.m. anymore. You have to go to bed early. It's talking about the yin-yang balance. You cannot just enjoy your cake every day, only once in a while. You can't be angry all the time. You have to be calmer. You won't have your cortisol level rising. So this is actually the more comprehensive talk. It's all about lifestyle modification. And the acupuncture is a small part. Herbs also a small part. Yeah, you tend to have the yang deficiency, which is not in your favor, for preventing cancer from coming back. So we always need to, push your adrenal function, your thyroid function a little bit higher.
Yes.
Give your body more qi, yang and qi. So that will be probably more beneficial.
So someone who has a yang deficiency or a qi deficiency is a weakness in their inherent energy. may be more prone for the cancer to come back if that isn't remedied.
That's right. In general, from TSM perspectives, like what is the root cause you may have cancer? And there are many theories. But personally, I strongly believe that yang deficiency is a major factor. At yang deficiency, you translate into conventional medicine, you may have your adrenal fatigue, you may have a hypothyroidism, you have a chronic infection. That all could cause yang deficiency with toxin. There's a term we call cold toxin in Chinese medicine. So I would say the cold toxin concept is probably the exact equivalent of chronic inflammation. So if it's acute, like heat toxin, it's more like the infection. You see the redness, you see the hard to touch, you see that even fever. But the cold toxins in the system, you don't see it. Yeah, your body is not able to completely remove it. Yeah, that basically wears down your immune system, wears down your adrenal function. So yang deficiency and cold toxin accumulation. Yeah, that's one major pattern. Yeah.
Yes.
In cancer development.
I wish this was going to be a 4-hour-long podcast because I'd love to get into all of the different patterns and the actual treatments. I do teach so many CEUs on this. So for practitioners who listen to this who are interested, you have a multitude of CEUs available for people to go in depth into particular herbs and particular diagnoses. I've taken many of your classes myself. I know how good they are.
Thank you.
In a little bit of the time that we have left, would you be willing to share one or two interesting cases of someone who you may have seen with a diagnosis and how you treated them or how their outcome was?
Quite a few patients. That's very, very interesting. One patient I want to share, the patient came in the same week. She got diagnosed with the stage 4 pancreatic cancer. That was 6 years ago. We were able to work together with oncologist, surgeon, acupuncture, herbs. So survived surgery, survived chemotherapy for probably 2 years period. She only takes 2 formulas to support her system. And she had rarely any major side effects. Most recent like scan, there's still a little bit tumor there, but everything else is fine. It's 6 years now. She's functioning very well. If you don't see the patient, you can't believe.
Yeah, 6 years and she's still alive.
She's still alive. She was taking half dose of chemo for 3 months and then stopped. So right now it's been another 6 months. Two formulas. Rarely we change it. One formula to boost the qi, so that we know is strengthen the immune system. Another formula we use to help flush the lymph system. You strengthen the qi, and you get the pathway open to remove the toxins. This is for pretty much the whole time. Rarely, we may adjust a little bit here or there, but because from the very beginning, we need to keep the immune system strong, and we need to open up the lymph system, make sure the toxin can go out.
Absolutely amazing.
If you don't see the patient, you can't even imagine, because stage 4 pancreatic cancer, that's probably the worst of the worst when it comes to cancer patient. Other patients have stage 4 lung cancer patient, 9 years. So they're, just the one particular formula. Gui Pi Tang. Gui Pi Tang is also a immune boosting formula, strengthening the immune system. So she likes that formula. She likes that feeling because it makes her mood very good for at least the past 5 years. This is the only formula she's taking. Yeah. So it's 9 years. And everything's good. So that's the type of cases. If you focus, what you want to address, and there's also a reason for it. There's explanation for it. You know why, and you need to know how.
Yes.
When you use it correctly, it's very much beneficial. Sometimes you can't believe. It's like, is that right? The patient's still around.
I wanted to take this moment to give an example that you know very well, which was the case of my father. My father got diagnosed with tongue cancer, and it was stage 3, stage 4. It was tongue cancer, and it had gotten into the lymph nodes. And he had a very large tumor on his neck. This was when I was still a student. I turned to Dr. Wen, who was able to treat my father before his surgery, after his surgery, during radiation, and then after radiation for about 6 months with herbs. Dr. Wen was able to guide me when I went to my family's home to give acupuncture to my father. My father had part of his tongue removed, and then he had 33 rounds of radiation where I was giving him acupuncture every day, and he was taking these herbal formulas all through this process. With the herbs, under the guidance of Dr. Wen, my father not only did not lose his salivary glands, so most people who have tongue and throat cancer, and then they have the radiation, their salivary glands stop working from the radiation and the heat, and then a multitude of problems can occur from that. They no longer produce saliva, the teeth will rot, they can't digest food, they can't swallow. They also can't sleep at night because they wake up from the dry mouth. So it's a horrible existence. My father had a few other people going through the exact same radiation at the same time that he did, and they did lose their salivary gland function. And they told my father they would rather be dead than have lost that salivary function because it was such a miserable existence. However, my father not only did not lose his salivary glands, but he produced copious excess saliva throughout the entire radiation process and afterwards, so much so that he had to walk around with a plastic spit cup because he had had tongue cancer and he didn't have control of his muscles to close his mouth, and he was drooling his copious excess saliva all through the 2 months of radiation. This is how effective these herbs and this treatment was. So I have firsthand knowledge that this medicine is not only extremely effective to prevent the cancer from coming back and to stop the cancer in its tracks, but also to prevent all of the side effects as well. So I've thanked you over the years. I'm going to thank you one more time in front of all of our listeners. I hope that story was interesting for some people.
Oh my God, that was almost 2 yeah, that's right, almost 20 years ago,
almost 2 decades ago at this point. And his cancer never came back. We had continued herbs afterwards for, I think, about 6 months, maybe even a year, and then slowly stopped the herbs. But the cancer never returned. So, yeah.
I'm so glad, he did drink all the nasty herbs. I remember the very beginning, he wasn't so pleased.
He thought the herbs were very gross, but he was a client patient, and I was there, of course, as well. So I made him do it, and he was a good patient. I could talk to you forever. We are wrapping up our time. I did have 2 quick questions for you at the very end for our listeners. First, do you have any herbs or supplements or any sort of holistic routines that you follow yourself? I've known you now for 2 decades, and you are so young and so youthful and so vibrant. What do you do to stay healthy?
Thank you. If there's one thing we talk about, how to boost your righteous qi, that one thing is a qi tonic. So the qi tonic, we're talking about the astragalus or ginseng. You don't need to take a lot. A couple of capsules, about 1 gram, 2 grams. With cold, you get started. And the other, from TSM perspective, the emotion, how to manage. We always say, try to, the inner peace, it's not just saying it. You really need to do whatever you can. We talk about the meditation and good sleep to get started. You have to have a good sleep, and then your mood can be better. If you lack of sleep, you can't have a good mood. The emotion, very well balanced emotions. We have the emotional distress or the emotional trauma. A lot of these emotions we can control ourselves. This is like teaching from Lao Tzu, from the Dao De Jing. Right? Go with the flow. There's a lot of things we have no control, but the only thing you have control is your own emotion. You can control that. That's the only thing. Yeah. And from, the Yellow Emperor's book from 2000 years ago, what make people sick? There's the first thing that people need to adapt to the weather change. If it's getting cold, you need to put on more clothes. If it's getting hot, you need to take off the clothes. And from food, you can't drink alcohol like soft drinks or whatever too much. Literally, the sentence they use is like people drink alcohol like drinking water, and that's how they get sick. 2,000 years, we haven't changed much. A lot of people still do the same thing. The part is like you need to be physically active. They don't talk about, you have to go to the gym, lifting 200 pounds. No. You have to be physically active. And the last, most important, emotional balance. So that's from all the teaching from Yellow Emperor's book from 2,000 years ago. It still applies.
Relevant, yes.
Still relevant, yes. Right? Yeah.
Yes. Thank you. That's good advice for everyone, and it certainly has been working for you. So, and lastly, is there any one thing that our listeners might want to know about you? Do you have any particular hobbies or something about you that would be interesting for people to know outside of course, your career and your passion with this medicine?
I like books. Yeah, so reading books probably is the best hobby. I think reading book to me feels like meditation. You're really into that world. You don't get bothered by outside noise. It's like your own world meditation. I also like hiking, so I go hike with my friends on the weekends. But reading, definitely, if there's anything talking about for self-cultivation, cultivate your qi, that's a good way to cultivate your qi.
Yes. Thank you so much. If our listeners want to find you, it's wenacupuncture.com. Is that correct?
That's right. Yeah. So people, if they're interested, they want to know more, go to www.wenacupuncture.com. One word. We also do telemedicine herbal consultation. If you're interested more in exam, integrative oncology, I have the CEUs, the recordings from the past lectures. Yeah, so there's more info.
Yes, excellent. You are such an excellent teacher. They're very good classes. Thank you so much, Dr. Wen, for being with us today. This was such a pleasure and such an honor to have you here.
Thank you for having me, Gretchen. Thank you. It's my pleasure.
Thank you. That's all for today's episode of Elevated Practice. I'd like to express my gratitude to our guests today and always for sharing their wisdom with all our listeners. I hope you were able to take away some insights, practical knowledge, or inspirational ideas that you can apply right away to elevate your own practice. You can find us on Spotify, Apple Podcasts, and YouTube. Don't forget to subscribe and tell your friends and colleagues about Elevated Practice. If you have an idea for an episode or a recommendation for a guest, please respond in the comments or message me, Gretchen Badami, directly through social media. Thank you, and I can't wait for you to hear our next episode.